Hello everyone. Earlier, we learned about the concept of hospice care. Hospice care refers to the provision of physical, psychological, and social support for terminally ill patients and their families. In the previous session, we learned how to provide physical care for terminally ill patients. Next, we will learn about the psychological changes in terminally ill patients and how to provide psychological care for them. When facing death, everyone's psychological reactions are very complex. Scholars at home and abroad generally divide the psychological state of terminally ill patients from the time they learn about their condition throughout the entire terminal stage into 5 stages: denial, anger, bargaining, depression, and acceptance. In practical work, these 5 stages do not necessarily occur and develop in a fixed order. Some may occur earlier, while others may be delayed. The duration of each stage also varies. Therefore, in our actual nursing practice, we must adapt to individual differences. When most people learn that they have an incurable disease and are about to face death, their initial reaction is usually strong denial, thinking it's impossible and that there must be a mistake. We call this stage the denial stage. Patients may believe it's a misdiagnosis and often seek medical opinions from various places wishfully, hoping to overturn the diagnosis. Most patients can move past denial relatively quickly, but some remain in the denial stage until death. From a psychological perspective, denial is a way to temporarily escape the intense sense of oppression caused by the harsh reality. This is a psychological defense mechanism adopted by patients. Therefore, when providing care, we should not rush to confront the elderly's denial, nor should we reinforce the idea that this isn't true. We should use nonverbal communication skills to meet the patient's psychological needs. Listen carefully to what the elderly have to say and provide sincere care. Show understanding for their current psychological reactions. As the disease progresses, when patients can no longer maintain denial, their psychological reactions are typically anger, resentment, and jealousy. We call this stage the anger stage. They might think, "Why me? Heaven is so unfair." During this stage, patients are dissatisfied with everything and often vent their anger on those close to them, such as medical staff, friends, and family members. They complain about inadequate care from their families and are highly critical of treatments and nursing care. When providing care, we must understand that the elderly's anger stems from fear and helplessness rather than being directed at family members or medical staff. When the elderly are angry, do not argue with them, do not try to comfort them, and certainly do not try to stop them from expressing their anger. Allow them to vent their emotions and meet their reasonable needs. After the anger subsides, patients begin to accept the fact that they are in the advanced stages of the disease. In order to prolong their lives, they start paying attention to their condition again, holding on to hope, and actively cooperate with treatment. We call this stage the bargaining stage. From a psychological perspective, the bargaining stage reflects the human desire and instinct to survive, and is a natural psychological process. During this stage, we must enhance care to promote patient comfort and alleviate pain and other uncomfortable symptoms. At the same time, provide positive guidance, communicate more with the elderly, encourage them to express their inner feelings, and help reduce their stress. We should also honestly inform them about the potential effects of various treatment measures on the disease to prevent the elderly from developing overly high expectations. When patients find their physical condition deteriorating daily, and bargaining can no longer prevent death, they experience a strong sense of loss. They may exhibit low mood, taciturnity, slowed responses, sad crying, etc. They request to meet with relatives and friends, and hope to have someone to accompany and care for them. We call this stage the depression stage. When caring for patients in this stage, we must accept their emotions, allowing them to cry and remain silent. According to the patient's wishes, arrange meetings with relatives and friends to increase social support. At the same time, we must closely observe the patients, pay attention to psychological counseling and death education, and prevent potential suicidal tendencies. After a period of depression, patients appear calm and composed and have made preparations for the impending death. We call this stage the acceptance stage. When caring for patients in this stage, We should proactively ask and help them fulfill any unfinished wishes, provide a quiet and comfortable environment for terminally ill patients, and minimize external disturbances. Encourage family members to spend more time with the elderly. There is no distinction between good and bad emotions in terminally ill patients. All are normal psychological reactions. We must integrate factors such as the elderly's psychological characteristics, personality traits, and life experiences to flexibly address their negative emotions. Be skilled in listening and adept at detecting subtle emotional changes in the elderly. Sincerely empathize with the physical and mental suffering of the elderly, and be skilled in providing guidance. Finally, I'd like to share a passage I once heard. It goes like this: "The feeling of death is that you will stand in a dark tunnel. You will hear terrifying sounds you have never heard before. You will see terrifying lights you have never seen before. You will want to grab onto something, but you won't be able to grasp anything. You will only have loneliness around you. If at that moment, we can reach out our hands to hold theirs, letting them know they are not alone, that someone is there accompanying them, perhaps their fear of death will be lessened." I hope everyone can pay attention to hospice care, so that those about to pass away can depart peacefully, and those living can continue to live well. Thank you, everyone.